Welcome back. My name is Dr. Suzanne Chomitz, and I'm a clinical psychologist at Sullivan Associates. This video will discuss ways of managing anxiety related to COVID-19 and going back to school. It will be divided into two parts. These unprecedented times can make even the calmest of us feel anxious. So many things have changed. Our daily lives have been disrupted and no one is certain what's going to happen in the future. In addition, many of us are unable to engage in hobbies or positive coping strategies due to COVID-19 restrictions and social distancing. Notably, kids might not have the words to express their emotions, including feelings of anxiety. Anxiety in kids can actually present differently than it does in adults. For instance, they might have specific symptoms, like complaining of a headache or a stomach ache. They may refuse to cooperate at home or demonstrate separation anxiety. They might also have more tantrums than normal or have difficulty sleeping. There are many ways children can learn to deal with anxiety. We'll go over a few. Try deep belly breathing. Number 1, start by taking a slow, deep breath through the nose, which should take about 4 seconds. Tell kids to imagine they're filling up a balloon in their belly so they can see their belly inflate. Or imagine smelling a big bowl of soup placed in front of them. Number 2, hold the breath for 1 to 2 seconds and then slowly exhale through your mouth, again for about 4 seconds. Imagine the air emptying from the balloon so they can see their belly deflate. Or you can pretend to blow candles from a cake. Wait 2 or 3 seconds before taking another breath, and then repeat the whole exercise several times. Mindfulness can be described as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. When we're anxious, we're thinking about troubling things that might happen in the future. Mindfulness helps break up this pattern of thinking by allowing us to focus on what's happening now in the present moment. Mindfulness can help people identify, understand, and accept emotions, which might be difficult for an anxious person to do. In its most basic form, mindfulness can be used to increase attention to our breath. Next, we can teach children to develop awareness of their thoughts and feelings. This allows them to understand that they create their own thoughts, that thoughts come and go, and that thoughts affect our feelings and our actions. To teach self-awareness about the environment, try having the child pretend that they are a camera whose lens is focusing on all the details about their own experience and playing it back as it is happening. Or the child could pretend to be a newspaper reporter and write down their experiences of their day. You can also play games like I Spy, which encourages kids to focus on their environment and to be in the present moment. Tolerating uncertainty is a key component in managing anxiety. Here are some ways to build this skill. Remember to focus on the things that we can control. So for example, structure the day. This helps kids to know what to expect. Avoid giving too much reassurance. Kids can start to rely on reassurance and get overly anxious when it's not provided. Focus on reminding the child what they're doing to take care of themselves, like proper hand hygiene. Try to encourage them to problem solve, instead of saying things like, oh, don't worry, or oh, it's just going to be fine. Try problem solving together. So if something happens, what are some things we can do to deal with it? This helps to coach them about ways of coping and gives them tools to handle unexpected situations. Be a calm role model yourself. Children learn from watching us, so make sure you're modeling good tolerance of uncertainty yourself. Try to encourage your child to engage in positive thinking as much as possible. Think of things to be grateful for and find the silver lining in the possibly negative solutions. Lastly, be aware of avoidance behaviors. For example, a child may ask to go home early from school due to feelings of anxiety. Although it might seem okay, even for just one day, this actually reinforces their avoidance and it can actually make anxiety worse in the long term. So for example, the next time they're at school, they might even have more awareness of their anxiety symptoms, like an increased heart rate or butterflies in their stomach, and they might be more anxious as a result. To help cope and overcome feelings of anxiety, we need to slowly push ourselves into situations that make us anxious. When we do this, we learn that we are actually overestimating the likelihood that something bad will happen, while underestimating our own ability to cope. In summary, there are numerous evidence-based strategies for managing anxiety. Check out our next video, Ways of Managing Anxiety, Part 2. Also, feel free to find us on Facebook or to visit our website, www.drsullivan.ca, for more information about anxiety and how to treat it. Like and subscribe. Bye!